President Cyril Ramaphosa has announced that the country will remain on adjusted alert level 4 for another 14 days in an effort to contain the spread of the coronavirus. Gatherings also remain prohibited and the curfew is still from 9 p.m. to 4 a.m. He says schools will remain closed until the 26th of this month. Ramaphosa says the sale of alcohol is still not permitted. Ramaphosa has also announced other adjustments.
The following measures will remain in place. All social, political, religious and other gatherings remain prohibited. A curfew remains in place from 9 p.m. until 4 a.m. and only those with permission to do so may leave their homes during this period. The sale of alcohol remains prohibited. Schools will remain closed until the 26th of July. It remains mandatory, in other words compulsory, to wear a mask that covers your nose and mouth whenever you are in public. We are, however, making the following adjustments to alert level 4 regulations. First, restaurants and eateries will be able to operate while observing strict health protocols. Such establishments may not accommodate more than 50 people at a time, or for smaller venues, more than 50% of their normal capacity. Certain other venues, such as gyms and fitness centers, may also open, and activities such as agricultural livestock and game auctions will be allowed, subject to the conditions outlined in regulations.
All right, the National Institute for Communicable Diseases has reported 16,302 new COVID-19 cases. This increase represents a 30.4% positivity rate. A further 151 more people have succumbed to COVID-19 related complications, taking the death toll to 64,289. Gauteng has registered 8,543 new coronavirus cases, followed by the Western Cape with 1,945 cases. And to talk to us about more on President Ramaphosa's address is vaccinologist Professor Shabir Mahdi. Professor, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Good evening. Thank you for having me.
Well, apart from the fact that President Cyril Ramaphosa shot straight to the point from the word go, and that there isn't much, additions in the lockdown restrictions. So what's your reactions to his address earlier on?
So unfortunately, it doesn't come as too much of a surprise that we were needing to continue with a level 4 restriction. It was extremely unlikely that much was going to happen over the course of 2 weeks. In fact, for some of the provinces, including KwaZulu and Western Cape, it's very likely that they will continue experiencing an increase in the number of cases even during the course of the next 2 weeks, which will again which will require difficult decisions to be made 2 weeks from now. Fortunately, in Gauteng, at least, we seem to have peaked, but the hospitalization and death, at least for the next 2 weeks, will probably continue increasing because that usually lags behind by about 2 weeks compared with infections that take place in the community. So, like I said, not too much of a surprise. I think the options that we have at hand is fairly limited, more so because we're dealing with a variant which is much more transmissible, much more infectious than anything that we've seen in the past. And the number of people that are getting infected over a short period of time is really phenomenal. It does come as a surprise that we are allowing for indoor dining in restaurants, and I do understand that industry is really suffering, but at the end of the day, any sort of activity which occurs indoors, where people are not wearing masks, and obviously you can't be wearing a mask in the restaurant, lends itself to super spreader events. We need to realize it's not just the people that are attending the restaurant that are at risk, it's also their contacts eventually that end up being at risk of being infected. So that does come as a bit of a surprise, but I guess it's really trying to appease different constituencies.
Well, seeing that the infection rates are peaking almost on a daily basis, it does appear then that the non-pharmaceutical interventions that have been put in place are not working. So do you think and believe that the president should have imposed even stricter lockdown regulations or restrictions, I beg your pardon?
Yeah, so I mean, yes, if we do impose stricter lockdown restrictions, we would get some breathing space. But as soon as we start lifting those restrictions, we'll start getting a resurgence again. So going into a lockdown in a country such as South Africa is not the solution, it's a holding measure. And the reason for that is we don't have a highly vaccinated population. And in 2 weeks from now, we might have changed from 6.5% of the population being vaccinated to maybe 10%. But that itself is completely inadequate to make any sort of meaningful impact when it comes to limiting the spread of the virus. So it's really going to level 5 restrictions will just damage livelihoods, will pretty much destroy the economy with very little gain, because, like I said, as soon as you start lifting those restrictions, especially for some provinces that are yet to peak, you would get the immediate rebound of cases.
And the announcement that those between the ages of 35 to 49 will be vaccinated, and that's in addition to the teachers and the police, are we well on course to achieve herd immunity?
No, I think herd immunity is a misnomer. We're never going to get to herd immunity, and we should stop speaking about herd immunity. It's a construct that we believed in 1.5 years ago. Very few scientists, given the way this virus continues mutating, actually believe that you're ever going to get to herd immunity. It's really about ensuring that we protect high-risk individuals from being hospitalized and dying. As an example, in the United Kingdom right now, they're experiencing more number of cases than South Africa, although they do about 10 times more testing as well. But at the end of the day, those cases are not translating much into hospitalization and death. So you can live with the ongoing circulation of the virus, but what we need to be protecting against is hospitalization and death. And the only sustainable manner in which to accomplish that is by ensuring that we vaccinate. So yes, it is good that we're going to be lowering the age group, that we're going to allow for vaccination. Hopefully we do have the vaccines available and our facilities aren't overwhelmed in place of actually ensuring that we still prioritize people above the age of 60 and those that are at high risk. But it's not because we want to get to herd immunity. It's about us wanting to protect people against severe disease and death.
There's various schools of thought and, wide-ranging literature with regards to reinfection. We do understand that individuals who recovered from the COVID second wave have a 65% lower risk for reinfection than those who had never been infected. So what are your thoughts on this?
Yeah, it largely depends also which variants are circulating. As an example, when the Beta variant started to circulate in South Africa, earlier infection with the original virus didn't actually confer more than 25% protection against the infection to the Beta variant. The Delta variant is more susceptible to antibody that was induced previously by the original virus and possibly also the Beta variant. So we'd expect people would still get reinfected, but to a much lesser extent than would have been the case with the Beta variant. So it really depends on which variant we're looking at. But again, the important feature of people that are getting reinfected, it's really the exception rather than the rule that those people that do get reinfected would end up in hospital. Your subsequent infection generally will be less severe than what you originally experienced. And the reason for that is your body has better equipped itself to be able to get rid of the virus as quickly as possible because of the immunity that was induced by the past infection.
And what's the risk of emergence of new variants as more infections, continue, or the more the virus spreads?
Well, yeah, I guess by the end of next year, we'll probably be at the end of the Greek alphabet. The virus is going to continue evolving, unfortunately. We can expect further variants during the course of this year. But the big issue is whether the vaccines work in protecting against severe disease. So the variants might be able to evade the antibody responses that are induced by the vaccine, which allows mild infections to take place. Mm-hmm. But the protection against severe disease is not that much dependent on the antibody responses, but another arm of the immune system, which is referred as T-cell immunity. And that T-cell immunity is relatively preserved, despite the mutations that are taking place in the spike protein. So yes, we will continue experiencing the evolution of the virus. New variants will continue arising. But the most important feature is that it shouldn't evade the T-cell immunity, which is really what assists for these vaccines, as well as past infection, to protect against severe disease and death.
Well, President Cyril Ramaphosa, in his address a short while ago, hailed U.S. President Joe Biden for his announcement that the United States would be donating 15 million doses of the vaccine. Remember that in a virtual speech to the 74th World Health Assembly, Ramaphosa said that the world needed to sort of deal with the vast disparities in the provision of vaccines. Surely the first world is now listening to the third world's cries for help in the distribution of vaccines.
I would say it's way too little. We need to understand that each day there's over 35 million people that have been vaccinated each day. In the whole of Africa, up until now, there's just over 60 million people that have been vaccinated. Those additional 50 million doses, it's most welcome, but it's going to have a nominal impact in terms of protecting people on the African continent. We don't need 50 million doses of vaccine. We need close on to about 1 billion doses of vaccine next 2 to 3 months, and not next 2 to 3 years either. So yes, all vaccinations are most welcome, but at the same time, high-income countries, including countries such as the United Kingdom, United States, Canada, countries that have oversubscribed to the amount of vaccines actually require, could very much release the bulk of those vaccines instead of using it for children who are not at risk of developing severe disease, and instead of planning to give a third dose of vaccine when Africans remain completely unprotected. So I'm not really impressed by really a token gesture of donating 50 million doses of vaccine to the African continent.
So ideally, which vaccine would you rather prefer that South Africa gets? And I think we need to, just talk about the efficacy of each vaccine, the Pfizer vaccine and the Johnson & Johnson vaccine.
Look, at the end of the day, all of these vaccines are going to work pretty well against severe disease and death, including the Sinovac vaccine for that matter. And certainly the Pfizer vaccine, the Johnson & Johnson vaccine, and even the AstraZeneca vaccine, 2 doses of the AstraZeneca vaccine against the Delta variant provides more than 90% reduced risk of being hospitalized. So we expect all of these vaccines to work reasonably well against severe disease, but the vaccines do differ in terms of how well they protect against mild disease.
Okay.
And I think the messenger RNA vaccines, the Pfizer and the Moderna vaccine and the Novavax vaccine probably would work much better than the Johnson & Johnson vaccine, and possibly even better than the AstraZeneca vaccine when it comes to protecting against mild disease. But that is not something that we really need to focus on right now. What we need to focus on right now, again, to emphasize, is protection against severe disease and death. And the whole issue of us getting to herd immunity, that would have been, then the type of vaccine that we use becomes important, but that is not featuring on our radar for any time in the near future.
Okay, Professor, great chatting to you. Thank you so much for your thought. We appreciate your time.
Thanks, bye.
That is Professor Shabir Mahdi, Professor of Vaccinology at the Wits University. And while addressing the nation this evening, President Cyril Ramaphosa said that over 4.2 million people have been vaccinated since the commencement of the vaccination of citizens. He said that plans to increase the vaccination sites and times are well underway in all provinces.
Plans are in place in all provinces to expand many sites to vaccinate either 6 or 7 days of the week. And this will be achieved by the provision of funds for overtime and recruitment of additional medical staff and health science students, which is now underway. All those who qualify for vaccination are encouraged to pre-register to speed up the process at vaccination sites. However, all sites do also allow unregistered people to walk in and to be registered. Now, I'd like to encourage all South Africans who are eligible to register to do so and to get their vaccine.
All right, we're still taking reaction from the different stakeholders with regards to President Cyril Ramaphosa's speech earlier on, and he did maintain that the country will remain on alert level 4 as a result of the peaking of the COVID-19 infections and the rapid rise of the COVID-19 related deaths here in South Africa. And in other developments, as you can see on the small screen on your bottom left of the screen, there's incidents of looting, and these are large visuals coming from Durban. And we've chatted to our reporter earlier on, Jade Lepolza, who says that people are on the rampage and damaging and vandalizing and looting shops. And we've seen Pick and Pay, for instance, people taking and cleaning it up, and some other shops, people taking refrigerators, washing machines, and microwave ovens. And this is clearly acts of criminality, as we can see. It's got nothing to do with a protest linked to the release of former President Jacob Zuma, as people have been opining in the past few days. This is clearly acts of criminality and vandalism. And it's very, very interesting that the number of protesters, or the looters as it were, outnumbers the number of police officers on the scene. I mean, this has been happening for the past hour or so, and no police is seen in sight. And even if there are, it is very difficult to say that they are in control of the situation. And also, we'll be chatting to our reporter here in Gauteng, Magaketla Mohlabe, who will be also giving us an update on what's happening here in Gauteng. We've seen earlier on protesters taking to the streets of Alexandra and the Johannesburg CBD, and our colleagues Natasha Piri and Gabin Jogweni were robbed of their equipment as they were covering that action. And just in reflection and commenting on the President's address earlier on, we'll now talk to the spokesperson of Dinosa, Sibongiseni Delihlazo, who will be giving us his reaction to the amended level 4 restrictions. A very good evening to you, Delihlazo. Thank you so much for joining us, and a warm welcome. Hi, Sibongiseni, good evening to you. All right, Sibongiseni, if you can hear me, please unmute your device so you'll be able to hear us. Hi, Sibongiseni, please unmute your device so you could be able to hear us. All right, we seem to have a problem connecting to Sibongiseni Delihlazo there. He